We are here and it is now 12 noon on January 8, 2021. And I'd like to welcome you to the Healthy Flint Research Coordinating Center's 43rd webinar on coronavirus. Today, as your moderator, Yvonne Lewis, I am just absolutely thrilled to be here with you. Didn't think a few weeks ago, months ago, we'd be having this conversation today, but I want to thank you for joining us today. You've joined the Healthy Flint Research Coordinating Center's community webinar, Coronavirus. And for background, the Healthy Flint Research Coordinating Center is a partnership between community and academic institutions, particularly the two academic institutions that are helping lead this charge is the University of Michigan Flint, University of Michigan Ann Arbor, and Michigan State University. Together, along with the CBOP Serb and our other co-director from the community, Tanya Turner, we are excited to be able to bring this webinar to you today. You can see here for the past 43 weeks, we have had a wealth of partners who have joined us across the screen. For those of you that have joined us by phone or maybe even by YouTube and you can't, or some other means that you can't see all of this beautiful banner of all of these partners, we encourage you, if you have opportunity, if you can't, get somebody who's tech savvy, as I'm learning about this tech, get somebody who's tech savvy and have them pull this up for you on YouTube, because these are memorialized YouTube. So you can see the array of community partners that have joined us for these 43 weeks. As I thought about this, I wanted to make sure that today you knew if you have questions that you can put them in the Q&A, but you can also give us a call at 810-835-2135. You can give us a call and we'll be sure to be able to answer those questions for you. Today is a pause for cause, or a cause for us to pause. I heard an announcement this morning that over 4,000 persons across this nation, we call them 4,000 souls, we lost this yesterday alone in one day to corona. And we also had a very, very challenging experience earlier this week by the White House, or the Capitol building being overrun and taken over. A lot for us to think about. I want you to know that those of us who are working on this webinar, we do listen to you. And so when we ask you to put your questions in the Q&A, it's really important to us that you do. And sometimes we get calls from some of you and say, this is kind of what we want to know, or this is kind of how we feel. So we've done something a little bit different today that we're going to ask for your participation. We want you to really clearly understand that this webinar was designed 43 weeks ago to bring information to our community to help us understand how we would deal with this coronavirus. It's not intended for us to cause you or to force you to make any decisions, but to give you information that you, based upon what you understand, can make the best decision for you and your family. So in keeping with that idea today, we heard you. We're not trying to make anybody or convince anybody that you have to take the vaccine for this virus, but we want you to understand some things. So that means we need to understand some things from you. So we have a poll that we'd like you to take today. This is our new thing. This technology is amazing. We have a poll that we'd like you to take today. So for those of you that are in the webinar and you can see this poll, we'd like you to go in and answer these 3 questions. And I'm going to go over the questions with you today, but we'd like you to answer these 2 questions. First question is, if the COVID vaccines were available to you today, if you could get it today, how likely are you to get it? How likely are you to get the vaccine? Respond, I would not. This is one response. I would not get it. I'm undecided, or I would get it. Please take a few moments or a few seconds and answer question number 1. If the COVID vaccine were available to you today, how likely are you to get it? Please respond to that question. Second question, what factors are influencing your decision not to get the COVID vaccine? What factors are influence your decision not to get the COVID vaccine? The first response, and here you can answer more than one time. You may have multiple responses. So one is, I do not have enough information to make the decision. The other item, I weighed the risk and benefits and choose not to get it. I do not trust the system. I do not trust the vaccine. And I got to go to get all of these questions for you. The additional questions in that response category. I do not have a primary care physician. I do not trust the message. I do not trust the messengers. I am not a good candidate. Providers said I shouldn't do it. And lastly, none of the above. I would get the vaccine if I had opportunity. Thank you for responding. This is great. We have one more question for you. This is also a multiple response question. What factors are influencing you, excuse me, to get the vaccine? If the vaccine were available, what factors are influencing you to get the vaccine? Answer as many that apply to you. I believe the vaccine will prevent me from contracting the virus. I believe the vaccine is safe. I believe the vaccine will save lives. I want to get back to living a normal life. I am at high risk for contracting the virus or having a bad outcome. I trust the messenger that the vaccine will do me good. Next, my doctor's provider told me I should get it. I have enough knowledge to make an informed decision. And the last item is none of the above. I will not get the vaccine. So if you would just take a few moments and respond to those questions for us, and we'll give you the feedback shortly. Got a great technology person behind the scenes working on this for us. So I'm going to ask Dr. Deborah, once we get all of those items in, would you please let me know where we are and if we're ready to move forward?
Sure, happy to. It looks like people are still answering. We'll just give them another 30 seconds. In the meantime, Dr. Reynolds is going to sing us a little Earth, Wind, and Fire. Take it away, Dr.
Well, one of the, thank you, Dr. Deborah, you'll keep me posted. But again, I want to reemphasize to you, for those of you that are listening and for anyone that tunes in, our goal is to provide you as much information from varying perspectives so that you know, and all of us know, that there are many ways that we look at these issues, many, many concerns, but the goal is that we do our best to respond in an appropriate manner and that you feel like you're getting information that is relevant, that is timely, that's beneficial, that's helpful, and that you can make the best decision for you and your family. How are we doing, Dr. Deb? They're still coming in?
Yeah, I'm going to go ahead and end it, and then we'll share and let people see what they said.
Right. Thank you, Dr. Deborah. So now, while we're waiting for the poll to complete, I want to just ask all of our panelists. I showed you that wonderful banner of panelists who've been behind the scenes answering questions. I'm going to ask them all, come, we're going to open it up and we're going to see the full gallery. Everybody, let's come on now and let's say, what was that? Secret Squares we used to play a long time ago. I'm really dating myself.
Hollywood Squares.
Hollywood Squares. All right. So here's Hollywood Squares. Dr. Deborah, can you open it up so we can see the whole team?
Yeah, sure. Tail stop sharing screen, and then we'll have our Brady Bunch gallery view.
Yeah. So what I'm going to do is say Happy New Year to all of our panelists, and I'm going to ask our panelists. Now, this has been interesting. You've been sitting behind the scenes. Some of you have come forward and you've answered questions behind the scenes. And this is New Year now, so some of you I'm just seeing for the first time. Gary, I haven't seen you since 2020. I got to see how you're doing. So share with us, and I'm gonna pick on a couple of you, and then you can raise your hand so I can make sure I'm not missing anybody. But I want to start off. Let me just pick somebody. And Gary, since I picked on you first, how you been? How you doing?
Doing pretty good.
So what were the holidays like for you?
They went by way too quick. It was like there really wasn't a holiday break. There was still a lot of work that was taking place for us over the holiday break. We got the COVID relief bill through the legislature over the holiday break. So that was hundreds of millions of dollars in relief, for Michigan families and small businesses. So we were still working during that time. And, I had both of my kids during that time.
Yeah.
So it was pretty eventful for me, but a break is not what I can define it as that.
All right. So I'm going to shift over, and these are folks from our state, and so I really want our listeners to know how committed that our partners have been. Sharonda Grisby from the Office of Minority Health at the state, MDHHS. Hi, Sharonda. Welcome. I can't hear you, Sharonda. There you go. There you go. How you doing?
Hello, everyone. I'm fine. How are you, Yvonne?
Great. So glad that you're still on board with us. Stay with us. Stay with us. I see. Thank you. I see Dr. Rick Sadler, and I got to get through this quick. Dr. Rick Sadler, who's one of our co-directors for Michigan State. Say, hey, Dr. Rick, and you got to let us see your face. There he is.
Hey, how's it going, everybody?
Yeah, that's how Dr. Rick is. Hey, how's it going, everybody? You all right for the new year, Rick?
Yeah, getting back into the swing of things slowly.
Great. Awesome. Okay, then another one of our co-directors, Tricia Pachowski from University of Michigan. Hey, Patricia, glad to see you. Thanks for being on board and helping us out. I'm going to go quickly. Ella Green Moulton, who is the administrator of the CBOP Serve. Hey, Ella.
Hey, Yvonne. Hey, everybody. Happy New Year. I'm doing good.
Awesome. Check in.
Learning how to live with this thing.
Yeah. And I'm learning how to live with this technology. I tell you, it's really something. We're going to hear a little bit later from Dr. Wolfer. So I'm going to hold and come back to you. Hey, Katie, you gave us some good insights before the end of the year. So how we doing this year for mental health? Going to be all right?
Yes, we're going to be all right. It has been such a tough year, but we are a resilient community. And our community and our county has always proven that. So we do need to focus on resilience.
Awesome. Now, a couple folks behind the scenes, before I get to them, I want you to be ready because they never talk. Tay never talks. Nina never talks. I just want you to say hey. But Jim Melanowski's been hanging out with us, and I asked him earlier, how is he doing? I guess he's still here.
I'm still here. Yep. No, it's going to be a great 2021, and there's so much going on, and I'm anxious to get our staff back at some point to our office and do the work of the health plan. So
awesome. And we do have another special guest with us that hasn't been with us before. She's going to talk a little bit later, but I want to say, hey, Dr. Erica Marsh. We're going to talk a little bit more to you later, but we want to make sure that we get you, just say hey to the team.
Hey, everybody. Happy New Year.
All right. Thank you. Tay, hi. Folks don't see you often, but you're behind the scenes helping us out.
Hi, everyone.
Thanks, Tay. And Nina, you never say anything, but you're back there too. So just say hey, Nina.
Hey, everybody.
All right. And Dr. Reynolds, you coming up next too. So we'll hear from you. So hang on. So Dr. Deborah, do we have our poll results yet that we're ready to reveal?
Yeah, we have our poll results and everybody can see it. And I think one of the things that's interesting, there's a whole way, a model in research where people sometimes do things because they think they're doing what others are doing. They'll make a decision because they think that their decision fits the group norm. And so this is interesting. If whatever you think is the norm on the call, here's what people had to say. The poll results are up and everybody should be able to see them.
I can't see them yet because I see still the gap. Oh, I'm sorry. I forgot Ash Afton. Please forgive me for not letting you say hey.
You're fine, Yvonne. Hey, everybody.
Okay, and Suzanne Cooper, you coming up later, but say hey to everybody.
Hey, everyone.
All right, great. Now, Dr. Deb, I can't see the results.
I can see them. I can tell you what they say. I can see them. You just got to click on your poll. And people.
Oh, okay. Tell us. Walk us through. Click on my poll. Oh, there it is. I got the poll up. Okay. Tell us what it means.
Yeah. So based on what we got here, and again, our goal is to make sure that people have what they need, and this isn't the end all be all. It looks like about 20% of us say I'm not getting it. Almost another 20% say I'm still undecided, and the overwhelming majority, about 63%, say if it were available to me today, I would get it. I think this is important because we talk about vaccine hesitancy and some of these other things, but we don't really know where people are unless we actually ask them. What are the factors that they said are influencing their decisions for those who said they won't get it? The overwhelming response is none of the above. If I could get it, I would get it. But among the people who said I'm a no, they don't have enough information. And then I don't want to also pretend that there aren't people who are very smart and who've gotten the information that's available to them and weighed it all out. And some 13% said, I've weighed the risks and the benefits, and I just simply choose not to get it. And of course, we've heard a lot about trust. So we've got some trust issues. We've got just under 10%, I'm sorry, just under 20% and a little over 20% who said, I don't trust the system and I don't trust the vaccine. Nobody said, I'm not getting it because I don't have a primary care physician. But we also do, we see a few people saying that they don't trust the messages that they're getting and they don't trust the messengers. And only one person said that they're not a good candidate or a provider told them that they should not get it. And we know that there are people for whom we've been told, if you are in this, high risk category, you are not a good candidate at the time. So, kind of some interesting things there, but it underscores the need for trusted, credible information. And then for the people who said they would get the vaccine, the overwhelming response that people gave to why was because they believe that the vaccine will save lives. And more than 50% of people said that that is the thing that's driving them. They also, by and large, believe that the vaccine is safe. They believe that the vaccine will prevent them from contracting the virus. And I'm sure Dr. Marsh and Dr. Reynolds and Dr. Wolford will speak to that, because making these decisions, whatever you choose, should be good informed decisions. And of course, half of us just want to get back to living a normal life. And it looks like for the people who said they would get it, they do have some trust in the message and the messenger. About a third of us are in that category, and about a quarter are in the category of being at high risk for contracting the virus or having a bad outcome. And the one thing that we absolutely know is that if you do contract the virus after you've been vaccinated, your chances of having a bad outcome or getting really sick goes way, 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 way down. So that's the snapshot.
That's the snapshot. We want to thank you all so much for participating in this. And this is like one of the late breaking ideas that came up that says because we are so sensitive to what you're saying to us, we're talking to you every week for 42 weeks now, but we needed to hear from you. So I certainly appreciate your responses to the poll. So I want to shift now and get to some of these detailed things that we've been talking to you about before and go right to Dr. Reynolds. Well, Dr. Reynolds, for the last couple of weeks, for those of us that joined us through our Facebook Live on the day after New Year's and day after Christmas, we talked about this Swiss cheese model. And you've really been able to explain this. And as Dr. Verholden just said, we're learning a lot, and there's a lot that we don't know. The vaccine isn't a magic bullet. And there's some things that we need to consider. So as the Chief Health Advisor for the City of Flint, I'm just going to ask you to walk us through this. And we'll probably review this a number of times, but walk us through the Swiss cheese model so we can get a better understanding of what steps need to be taken to ensure protection for our community.
All right, thank you. First of all, I got to give a shout out to all my people from the Georgia clan. Georgia is on my mind. They did the job. And so Stacey Abrams and the people who voted are amazing. So maybe I'll go back to Georgia one day. Having said that, let's go on to this Swiss cheese model. Okay, if you look at this diagram, you'll see vaccines are the last layer. Okay, and that does not mean vaccines are ineffective. It means that there's other work that we must do to make the vaccine as effective as possible. And there are the personal responsibilities, and that is if you're sick, stay home, maintain physical distance. Okay, the next slice is wearing your mask. The next slice is doing hand hygiene and covering your cough when you're out in public. The next slice, and I've said this is a challenge for me because I'm always adjusting my glasses, avoid touching your face. The next slice is if you go into a crowded situation, limit your time. And sometimes I just tell people, like they say in the Cupid Shuffle, back up. You don't have to go in there. Okay? And then we have the layer of responsibilities that are shared responsibilities. In other words, what we advocate for, what we push for, and what our government and our leadership should do. Number one, fast and sensitive testing and contact tracing. Number two, the building in which we go are well ventilated so that there's air filtration, air exchange, or we are outdoors. And that includes schools, churches, businesses. So I'm not letting anybody off the hook, and we need to open the windows in our house occasionally. Okay, the next layer, and I'm sure Dr. Furholden will have a lot to say about that, is government messaging and financial support, because we've been getting mixed messages and pieces of the financial support that we need as governments and also as individuals. The next layer is using quarantine and isolation. Quarantine if you've come in contact with someone, isolation if you are sick. And then the last layer, and perhaps the most durable once we get it, will be the vaccine. So whenever we think about, am I going to get vaccinated or not? Think about, am I also doing the other 9 layers of cheese to make sure that the vaccine is effective in our community? Thank you.
Thank you, Dr. Reynolds. And just there is so much. I want to ask you to touch on something, but I looked in the Q&A, and one of the individuals who's listening could not put a response in, and it's relevant to something you just said. They said, I am planning to get vaccinated, and no doubts about why or the outcomes. I don't want to get reinfected. So in order not to get reinfected, we need to do all of this, even if we get the vaccine. Is that correct?
That's true. And this person is saying that they have been infected in the past and they're concerned about reinfection. And they are right on target, because you are eligible for the vaccine. You should get the vaccine whether you've had COVID or you've not had COVID. So that's a good plan based on what we know now, because that will boost your immunity.
And that was a big question across the board we've gotten from a lot of people in our community conversations. One last point, Dr. Reynolds, and this was raised in an earlier conversation. We've got all of these places, but then there are some places that are missing that don't show up on here. And I just heard this analogy about a little mouse, running around trying to put some more holes in the cheese.
Do you see that mouse in there at the first yellow slice?
All right, point that out to us, Doc.
Okay, start from the red arrow and count back to the 5th slice, and you see a little mice there that's nibbling on that cheese.
We call him the misinformation mouse.
Yes.
He's the misinformation, because what misinformation does is it nibbles away at the importance of each one of these layers of protection. So we know for a fact that testing helps people to get identified and early and be able to get themselves and others out of harm's way. But if you hear information that when they do the swab, they're sticking a microchip in your brain or craziness like that, and you believe that, well, you have less confidence in that layer. It's the equivalent of punching another hole in that important layer. So the misinformation mouse has been gobbling up and punching holes in some of these layers. That's why this work and these messengers are so important.
Okay, so there's more to come on that. We can't cover it all today, but thank you, Dr. Reynolds, and thank you, Dr. Deborah. And since you're right there, Dr. Deborah, we've been collecting data here, and you said something the other day when we spoke that Michigan is really leading the way in looking at the data, particularly as it relates to the inequities and the gaps. So can you just walk us through what's happening with our brief right now?
Yeah, sure. I'm going to roll through this pretty quickly. We have this brilliant, I think just absolutely brilliant COVID health equity brief that we've produced. We are able to produce this every week and talk about equity and racial equity in COVID because we have data that speaks to that. And data is not perfect, but it is the data that we have. And one of the things that we've learned when we look nationally is Michigan was one of the first 3 states to report COVID data on cases and deaths by race. And lo and behold, we saw we had these big, huge disparities, 3-fold increase in COVID cases and deaths among African Americans. So we're 14% of the population, we were 32% of cases and 41% of deaths. Those numbers now we're finding out are worse in some places, but they don't either collect the data or they collect it, but they're not being transparent about reporting it. So if you aren't even willing to confront the problem, how can you possibly begin to solve it? How can you possibly say the things that we did are actually helping us to deal with these issues? So I just think it's a priority in our state at a minimum from our governor and our lieutenant governor, the wonderful task force that we have at the state, and then also the task force that we have locally. So I want to just give people a quick snapshot. This is what it looks like for the 5th week in a row in Genesee County and the 4th week in a row in Flint. We have actually seen a decline in COVID cases. We have seen just a little dip in the testing over the holiday because guess why? The sites were closed on some holidays. People weren't moving around exactly on some of those holidays. But if you look at the data over time, and the more we continue to look at it over time, we'll really be able to tell the story and we'll be able to tell it with great confidence. What I will say is I'm cautiously optimistic. It looks like we're doing the right thing. It looks like the things that we're doing are working and we're moving in the right direction. For that to remain the case, we have to stay the course. Going back to the model Dr. Reynolds talked about with all of those layers of protection, if you take any 1 or 2 or 3 layers out, you start to weaken that protective shield that we have. So we're moving in the right direction and things are trending in the right direction. Okay, next thing. Geographic spread. And it's really interesting because people, when the pandemic first started, said, I'm staying out of Flint. I'm not going to Flint, da-da-da. And then lo and behold, what we find is we've got hotspots all over the county. Flint still does remain within Genesee County, a place where we have some concentration of cases, but generally we've got pockets throughout Genesee County. And so the thing that I want to leave for people is that these hot spots persist in and around Flint, despite the decline in cases. And likely what that is because you're seeing a clustering of shared behaviors and shared values. If people make decisions about not wearing a mask as a political statement, and that phenomenon is something that is shared in your community, or a significant proportion of people in your community are sharing that, you remove an important layer of protection. And then we get what we call hotspots, where you get clustering of cases. And we do have that in Flint. So again, the recommendation for people is stay the course and let's really keep thinking through and practicing each one of those very important layers of protection. Last thing, our recommendations for our policymakers as we think about vaccine messaging and rollout, we're going to have to address vaccine hesitancy, which I think is valid, through evidence-based information and transparent communication. And it needs to come from people like us, from your primary care physicians, from others in the community, from our state, from our local health department, et cetera. We do need good public health communicators and community members to encourage our public to engage in all layers of the COVID response effort. The vaccine is one of those layers. Wearing your mask is a layer. All of these things are important because when you put them all together, we start to build a real wall of protection. And we got to keep dispelling information and continue to support our local health entities through resources that they need to improve distribution of the vaccine and equitable distribution, and continuing to eliminate any barriers for some of our most high risk and most vulnerable as it relates to access. If people have any questions about this report, it is being spearheaded by our fabulous Mary Catherine Crawford. She's a recent MPH from GW. She's a Flint native. She decided to bring her public health skills back to Flint. She wants to work with policymakers to make sure that they have what they need to make informed decisions. And if you have questions about the data, this is a partnership between Michigan State University and our fabulous, like rising to the top, like some really delicious cream, health department, the Genesee County Health Department, and our like shero and champion, Suzanne Cooper. So I encourage people to sign up for the weekly brief. You can email Mary Catherine at crawf457@msu.edu. She'll add you to the listserv. You'll get it. It comes out every Friday morning by 11 o'clock.
Thank you, Dr. Deborah. I saw that. And thank you, Dr. Deborah. And I'm so excited. I'm looking in this queue. I'm going to ask our panelists, please make sure you respond to the questions in the queue. And I'm going to ask those of you that are listening today, please keep putting those questions in. This is great, great, great today. You mentioned the need for us to have good information and credible messages. This next segment we're going to bring to you. We've heard other folks, we've seen people on TV that we may not even know getting these vaccines and sharing it. We have 3 of our local folks, when I say local, I mean state of Michigan, that are going to talk to you about their actual experience receiving the vaccine. Because as you know, and our governor mentioned, the rollout has already started. It's supposed to expand come Monday, but we want you to hear from some of our own. So Dr. Erica Marsh, who she is just an amazing professor of reproductive medicine. She's Chief Division Reproductive Endocrinology and Infertility Director of MISHAR and all of these wonderful things. I know her to be a friend, and I know her to be a true community person. She even spends time here on a weekly basis at Hamilton Community Health Network to provide special services to pregnant women. So Dr. Marsh, welcome to our webinar today. You will bring so much to this conversation today because you yourself have had the experience of getting the vaccine. So can you talk to us a little bit about that? And then we got a special clip we want to show. Dr. Marsh.
Uh-oh, I don't know what that means, but hi, Sister Yvonne. It's always a pleasure to partner with HFRCC. I want to make a brief correction. I come to Hamilton on a monthly basis to see gynecology patients. I wish I could come on a weekly basis, but I have colleagues that allow us to be here on a weekly basis. Awesome. I did get the vaccine. I got the vaccine actually on Christmas Eve. And it was when I was learning about the vaccine coming out, I was excited. And I have to confess, I spend a good amount of my time doing research. I am a researcher. I'm a data-driven person. I'm a firm believer in vaccines as an integral part of public health. We all get vaccines before we can go to school. There's pretty much nobody in the U.S. Public school systems, for the most part, who hasn't gotten at least your measles, mumps, and rubella vaccine. we were given polio vaccine, you know, all of the vaccines that we need. So vaccines are a part of our existence. Some are mandatory for certain aspects and some are not. But when it came down to me being in that tier 1A and being able to get vaccines early, I had pause. I was just like, well, wait a minute. Do I have, you know, have I seen enough of the data? Have I, do I really feel ready to be amongst that first group that gets the vaccine? And, you know, I thought about it. I looked at the data that are available. I was getting a lot of calls from friends and family and patients about the vaccine. I prayed on it because that's where I get, insight as well. And, I find for me, it was, based on the data that we have now, the vaccine looks like it's very effective in terms of saving lives. In terms of minimizing the number of people that are going to get really, really sick from COVID. And so I went on Christmas Eve morning before I was making a drive to Virginia to wave at family that I hadn't seen in a year. I was we had a plan in place to be very responsible. There was, we weren't going to go in and see a lot of folks, but we were just going to wave. And that morning I went in, I got in line. I had to be registered. They asked me questions like, did I have a history of anaphylaxis or very strong allergic reactions where I got short of breath? They asked me if I had received COVID antibodies recently, those types of questions. And then they basically said, this is injection 1 of 2. You need a second injection in 21 days, and pulled down my sweater, swabbed my arm, and gave me the shot. I have to say, I barely, and I'm somebody who's squeamish with needles, even though I order shots for people all the time. I do procedures all the time. But I didn't fall out. I didn't scream. I actually didn't feel the shot when I got it. I was just like, go ahead, I'm ready, go ahead. And she's just like, ma'am, it's done. You can go to the waiting. You can go to the waiting area. I was,
So you didn't act like a doctor at that point, right?
No, you can. These are not the slide that's up now. You can take that down. You can put.
Okay, let's go next. Come on, Dr. Deborah. Here's the real one.
Oh yes, I went. We drove through the night to see family, and I have to say, all the teaching, all the promotion I did. When I saw my grandmother, I lost it because I hadn't seen her in 12 months. And she is somebody who I see multiple times a year. And I ran into her house, which I was not supposed to, I was going to wave at her. And she put her hand up and she smiled behind her mask. And she lifted up her 97-year-old elbow and said, we're going to do an elbow bump. And I said, okay, Nana, if an elbow bump is what I can get, then I'm going to take an elbow bump. And we did our elbow bump, which you guys see there. And that was the best Christmas gift that I had in 2020, as well as my air hug from my aunt that you see also right there. So it was, I feel like taking the vaccine is not an easy decision, but I think it's an important one. Vaccines are part of our lives. Vaccines are proven to save lives. Yeah. And I know there are a lot of concerns about this one, about the pace at which it was developed. But for me, it was a decision, these pictures fundamentally show why I did it, because I want to save lives. I want our country to be in a place where I can not just elbow bump my grandmother, but hug her again and hug my aunt. And, we have a long way to go before we get there, but I think it's important.
Thank you, Dr. Marsha. And I think what's critical as we look at this is, even as a physician, with all of that, in that moment of emotion, sometimes we kind of forget. So it's really important. Put your mask on before you get to somebody you love. So if you get excited. So we still need, going back to Dr. Reynolds' example, we still need to follow these protocols. So thank you for sharing that and allowing us to share the picture of your Nana and your aunt. And so we had another one of our team members, Dr. Suzanne Cooper, who's going to come up next. She sent me a note that on January 1, so we had a Christmas vaccination, and then we had a New Year's vaccination. So Dr. Wolford, tell us about your experience.
Hi, Yvonne. Thanks so much for this opportunity. Yeah, it was very much like, so as you can see, I was afraid. I couldn't put the needle. And yeah, I was a baby. But, I went ahead and got the shot. And the reason was, I think as all of us, we have to weigh the pros and the cons, which is why I have our scales up behind me here. It's all about weighing those pros and cons for each of us. And so for me as a pediatrician, I think vaccines have made such a huge difference in our health as a world, not just our country, but worldwide. I think about when polio vaccine came out, and polio was such a dreadful thing in the country. And all of a sudden there was a way to stop this disease from ravaging children. And what would happen if people didn't take that vaccine? More children would die and more children would have the disease that didn't need to, because there was a safe vaccine that could protect them. And every time I'm in clinic, I am giving orders for kids to get vaccines. So I certainly wouldn't do for other people what I don't believe I should do for myself. And so I think that vaccines are safe and they are wonderful. But like everybody else, I've been living through 2020, where we have questions about how our government does things and how things are run. And we know the history of medicine as it relates to minority populations. And so I had in my mind all of those concerns. But in trying to weigh it, what helped me decide that I wanted to do it versus not was learning more and more about the process and why this vaccine is likely to be very safe, and allowed me to come down on this side of getting it. And it was very interesting because as I think you may know, my husband's a pastor, so of a couple of churches. So I spend a lot of time in religious settings, and there was a lot of people saying, just leave it to God. He's going to protect you. You don't need a vaccine. And then somebody sent me a video about, don't let that vaccine get into your system. It's the mark of the beast. And I'm like, wait a minute. I know what the mark of the beast is, and it is not a vaccine. And, I certainly prayed and felt the Lord was guiding in providing me with the information that I needed. And so by the time it got to Friday morning, I felt like I had enough comfort. I can't say for 100% certainty that nothing is going to be found 10 years from now or 20 years from now. But I had enough comfort at that moment to believe that there are more benefits to this than not. And I could help protect myself and protect others by going in there and getting that shot.
Yeah, so Dr. Wolford, this is interesting. You say you're a physician, which means you're a scientist as well, because you do research and all of that, and yet you had to work through this process and weigh out these options. And many people still have these questions. And the interesting thing is we all know that all vaccines have some side effects. We just don't know what they are yet. So when the question is asked, are all vaccines the same? Is one better than the other? Because we've got more than one vaccine type that's being promoted right now. So how would you respond to someone?
So I think that's a really interesting question. Vaccines have side effects, but for the most part, most of the side effects happen very early on, right? So for the most part, it isn't that 10 years down the road, you find out there's something wrong with this vaccine. That's not what we find with vaccines. We find that when they have side effects, it's happening very soon after you get the vaccine. And so I, in reading the information, felt that they had tried this on a huge number of people. And so that if there were going to be those side effects that tend to happen early on, that we would know about them. And so we know that, some people who are very allergic to things may have a problem. I know that's not me. But nonetheless, I still chose to have it done in a hospital, because if by chance something happened, I would be in a hospital. They said to sit and wait for 15 minutes afterwards to make sure you were okay. I waited for 30 minutes just to be sure that I didn't have anything happening. So, I mean, but you can still, those things tend to happen in the beginning. And so otherwise, vaccines are very, in general, very safe. Now, the issue I think that many people have with this vaccine is that it's a new way of delivering the information to our body, as opposed to something like the AstraZeneca, which uses an older method. And so I think some of the concern is about this new method. In reading about it, it seems like this new method might be very safe. It seems very safe, and not only good for this situation, but might help us in the future with other situations that may come up. So that's where I think my reading came in, understanding that even though it's a new way of doing this, in some ways, there's a lot of science to suggest that it's safe, and the number of people that have tested it on already makes me feel more comfortable about its safety.
So thank you, Dr. Wolford, because you talk about new ways. And the one thing that we're often reminded of, that this is a new virus. We use the term novel virus. It's different. Our communities, our world has never experienced anything like this. So it's an ongoing experience of learning for all of us. So we want our listeners to stay tuned. We're going to try to make sure that we give you all these varying perspectives, so that when it's time for you to make that decision, you'll be able to do so based upon the knowledge and information that you have. We have one more person we want to talk to in this segment, and that is Suzanne Cooper, who Dr. Deborah mentioned earlier, has been here with us from the very beginning. She works at the Health Department. She's a Public Health Division Director. And Suzanne also got the the vaccine, the COVID vaccine, and she talked a little bit about that last week. So we want her to give a little recap for those of you that missed our last segment. Suzanne, tell us about your experience. The one thing I know, if we can switch to the picture, are you there, Suzanne?
I am there, and
okay.
I will tell you that I got my vaccination on December the 30th at 1:23 p.m. in the afternoon. I did wait my 15 minutes after to make sure I had no reaction. And I will tell you that the decision-making process for me was about mitigating risk. So some of us have pre-existing health conditions that make us more at risk for complications if we did have COVID-19. And I have a 17-year-old niece that I want to be here for. She is the reason why I think about what that risk is and whether or not the vaccine was an appropriate way to mitigate that risk. So I got my vaccination. I will tell you that I had a sore arm for 2 days after that I got my vaccination. I did sign up with the CDC's V-Safe program, and that is a program that asks you every day how you're doing, asks for some critical information about what signs and symptoms that you had. So whether or not you had arm pain, swelling at the injection site, other questions. Did you have a fever? Did you have chills or any of the other symptoms that people are concerned about? And asked if it interfered with my ability to do my work or if I was able to carry on. And I get that text every evening for 10 days after I get my immunization. And once I get my second dose, the whole process will start again. They will check in with me on a regular basis afterwards. So there'll be periodic check-ins to see how I'm doing after the vaccine. This is another way that we're being able to provide information through the CDC about what our experience with the vaccine is, recognizing that this is an emergency use authorization vaccine. So there's more evidence of what kinds of responses various people have when they get their immunization. So again, I had a sore arm. My vaccine was Moderna. Some others that had theirs in a hospital setting were the Pfizer vaccine. So my second dose will be 28 days after the first immunization. And I'm looking forward to coming back and sharing more with you about what that experience was like.
So
The second dose is usually has potentially more reactions than the first.
Thank you, Suzanne, because that's one thing that we had heard. And so I appreciate you mentioning that, because this is still a process of learning. And so we'll see what happens after the second dose. But it is clear that there are 2 doses. And right now, to dispel one of those pieces of misinformation, they're not cutting the dose. Everybody's getting the full dose for vaccine 1 and vaccine 2. Is that correct?
Absolutely. And you'll see in my car, I've got a paper in my on my steering column, and that's all the information about be safe. But it also is about all the signs and symptoms to look for if you are having an allergic reaction. So when I got my immunization, I pulled through the fire station I was getting my immunization at. I waited my 15 minutes. And while we're doing that, health department staff are monitoring the cars of those who've been immunized to make sure no one was having an allergic reaction. Had there been an allergic reaction, we had staff on board that would be able to address it. So I didn't get my immunization in a hospital setting. I got it at a fire station, as we would be doing with our community partners who don't get it in our Burton Health Center.
Thank you, Suzanne. And the other important thing here is that there are there's a lot of discussion now, because the governor made mention in her press conference last week or earlier this week, I should say, that Monday, the 11th of January, this was going to be made available to seniors and so forth. So we're going to talk more about that, but there is going to be a process through which people will be able to get the information about when and where to get vaccinated in the community. So we want our listeners to stay tuned for that.
I do want to say, Yvonne, it's so important to say that eligibility does not mean availability. And our challenge right now is that we don't have enough vaccine for everyone at this time. We're working very hard on getting it made available. We're working with our state and other partners to make sure that we can get more people vaccinated, but that's the limiting factor for us right now.
So in light of that, what we do know is we have sites set up in our community for people to get tested, because that's still really, really important. We still need to go and get tested. We had a break for many during the holidays because our sites were closed. Suzanne, can you give us just briefly run through these? We talk about it every week, but we just want to remind you that the COVID testing sites are still available.
And remember those layers of Swiss cheese that we keep talking about. Testing is such a critical part. And recognize that there are many people in our community who are asymptomatic, meaning they don't have symptoms, but can test positive for COVID-19, that it's important that you get that done on a regular basis if you're out and about and working in the community. We have 3 community testing sites that are set up through HANU of the state of Michigan, Word of Life, Bethel United Methodist Church, and Macedonia Baptist Church. They are using the oral swab, and they do by appointment, but they'll also accept those folks who come and don't have an appointment so that they can be cared for. We have the Walgreens in Flint. We have Rite Aid in Swartz Creek and in Flint, and we have our partners at Hamilton Community Health Network, their North Point Clinic, and at the Burton Fire Station at the corner of South Saginaw and Bristol Road. And I do want to give a shout out to Genesee Health Systems. They've been an amazing partner. They actually take testing to people who can't come to our testing sites. And they've been doing this throughout the pandemic. While they're not on the list, they are doing that work behind the scenes for those populations.
Thank you, Suzanne. And one other quick reminder, we want to let our listeners know that on ML King Day, Martin Luther King Day, which is January 18th, the sites will be closed. We will be not doing testing on that day. So please make sure to work around that so that you can get tested should you need it. And I know it's really critical for us to know our status. We have a couple of questions in the queue that I want to make mention of, and then we're going to ask Gary, can you get queued up to tell us what's going on at the state level? And then we have a few announcements for you. This is a very challenging times, and we've talked to you today about people who have had basically so far positive experiences. We have not yet heard of anybody who's had a negative experience with the vaccine. but this is a work in progress. This is a process that's going through. And I want to remind you, please listen carefully to what's been said. This is a process. This is a learning. And each of the participants on the panel today said they went through a process of considering necessary information to make that informed decision. And so we're encouraging you to do the same thing. As we get more information, we'll do our best to provide that information for you. So Gary, I already kind of spilled a little bit what the governor said on earlier this week. So what other things do we need to know out of the governor's office?
Yeah, absolutely. I only have a couple of things today, Yvonne, but one of them is actually really, really important. So I wanted to start out with this because this is actually just hot off the press. House Appropriations Chair Thomas Albert said earlier today that the governor must take more steps towards reopening the economy before the legislature can have meaningful conversations about the next steps in allocating federal COVID relief funds. So holding Michigan tax dollars for COVID testing, vaccine distribution, education, keeping people in their homes, childcare, and feeding hungry kids, let me be clear, is reckless and dangerous, especially with a new variant of this virus in the United States that spreads even faster. The governor has rightfully made it very clear that she's not going to negotiate away Michiganders' public health. This is not a game. It's a deadly pandemic that has killed more than 13,000 people in our state. So these are people like Skylar Herbert, a 5-year-old from Detroit whose parents are dedicated first responders, like Sheriff Benny Napoleon. This virus has even taken the lives of current and former legislators that Republicans in the legislature served alongside for years. So Republicans must end partisan games and work with Governor Whitmer to get this done. And let me also give some background on what's really at stake here. So the federal funding that the chair of the Appropriations Committee is willing to withhold would be, the state of Michigan is poised to receive over $111 million in vaccine funding from the federal bill, and over $565 million to support testing, tracing, and COVID mitigation efforts. The bill includes over $650 million to address eviction, diversion, and rental assistance needs, and millions to deploy more broadband to help our students to learn, and business recovery from the economic impacts they've faced during the pandemic. It also includes roughly $125 million in emergency education relief dollars to help our students and schools recover, in addition to emergency child care funds that close to $287 million. So that's what's at stake. Also recently, real quick, the governor and a coalition of governors urged the federal government to release vaccinations to state. So Governor Gretchen Whitmer, the governor of California, Kansas, Illinois, Minnesota, New York, Wisconsin, as well as Washington State, sent a letter to Health and Human Services Secretary Alex Azar and Operation Warp Speed Chief Operating Officer General Gustav Perna, requesting that the federal government distribute the millions of safe and effective COVID-19 vaccine doses that are currently being held back by the Trump administration. According to the publicly reported information, the federal government currently has upwards of 50% of currently produced vaccines held back by the administration for unknown reasons. Also, I just want to flag for everyone that the governor will be doing a press conference update in the next, at 1:30, so in about a half hour from now. And also, I want to promote the website, the COVID vaccine website, which is michigan.gov/COVID vaccine. So that's the catch-all website, particularly for questions related to the COVID vaccine. And then always michigan.gov/coronavirus is the catch-all website for all things COVID related.
Thank you, Gary. And I'm telling you, everybody get on Gary's newsletter list and you'll get all this information all the time. We've got a couple of other quick announcements we're going to make because we're talking about opening up the economy and offering opportunities. Our local foundation has opportunities that are available. And so we want you to know about those. And then if we can get our next Afton, why don't you just come on, Afton, and give us a quick update about Recast?
Absolutely. I'm ready. So here is what we got. We talked about this last month. We released a new RFP for Recast funds for our community mini grant program for 2021. We announced this back December 15th. I remember only because on January 15th, these applications are due. So that means next Friday at 1 p.m., applications are going to be due for these requests for proposals for mini grants for the 2021 year. We're funding under the 3 goals that are listed there, RFP goal 1, 2, and 3. And if you want more information or you want the RFP so that you can apply, you can go to the website, flintrecast.org. If you have questions, since we don't have time for me to answer them today, you can shoot me an email at recast@flint.org.
Thank you, Afton. But I'm going to ask them not to shoot you. Just send it to her. Send it to her and she'll get
Send it over.
Send it over. Let me thank you, Afton, and all of our panelists today. Appreciate you so much. And for those of you that are still listening, stay tuned. We've got some other great things that we're going to share with you. A tip for next week, we're going to have Representative Kildee, who is going to come and give us an update on the federal stimulus package and how that's going to affect what we're seeing here. So please join us next week. But I want you to know that if you're a community health worker, you can get the CEUs from viewing this webinar today. And if you have not seen some previous ones, go there and make sure that you contact us for getting those CEUs. I also want to encourage you that you please like us on Facebook. There's the information there. Subscribe to our new YouTube channel, Healthy Flint, and always feel free to email us at info@healthyflint.org. Call us at 810-835-2130, and we'll be happy to answer those questions for you. There are still a few questions in the queue. We're going to get to those before we close out fully today, and we'll see you next week. We say have a safe holiday. Holiday is coming up, MLK, but we want you to have a safe life. Keep in mind these things that are necessary for us all to ensure that we're doing our best to stay safe and keep our families safe. Again, on behalf of the Healthy Flint Research Coordinating Center, let me thank you for tuning in today, and we will look forward to you being with us next week for more great information. Thank you.